You're watching City Channel 4, your window to our community.
Today, I think we are very happy to have Suellen Novotny with us, who has worked for years on her own and with a community group to prevent falls in our community. And the name of her presentation is Preventing Falls, Fall Prevention. So with that, I will welcome Suellen Novotny.
Thank you, Maggie. I am Suellen Novotny. I'm the Executive Director of the Visiting Nurse Association, and I'm very pleased to be here and talking about how we can prevent falls. As the Director of the Visiting Nurse Association, I can say we've been involved with an initiative for over 5 years with the Johnson County Livable Community. The initiative is called Sure Steps, and we've been chairing that initiative for some time now. And the statistics, which I'll be sharing with you today regarding falls in Iowa and in Johnson County, are staggering. So with this initiative of educating caregivers, I'm sharing this information with you today, both for yourself, to stay well, to be safe as you're caregiving for people that are often very challenged in terms that their health is affected, therefore they're weak. And I'd like to go through a few slides and then very much open up a conversation. I'd like to know from your point of view what you're experiencing. The objective today is I'd like to share as much knowledge with you as possible on how we can prevent fall risks, both in the home and around the home. What health conditions can lead to this, and how to minimize these falls. The statistics, as I mentioned, are very, very staggering. 1 out of 3 Iowans, 65 years and older, fall each year. 3,700 Johnson County seniors will fall this year. About 84% of injury-related hospitalizations that will occur in Johnson County will be due to falls. Those people will have a 4 to 5 time increase in terms of having to go to a skilled nursing facility after they're hospitalized. The Visiting Nurse Association does provide home health. We do have occupational therapists and physical therapists who come into the home to help people, and indeed we are helping people that have fallen. But if 24-hour care is needed and there's no one in the home to help that person who has now fractured their shoulder, their wrist, their hip, they will go to a rehab facility, at least temporarily. The message I'd like to give today is falls are not an inevitable part of being older. There are steps we can take to prevent falls. And really they boil down to 4 things. If we can just today gain the awareness that being active, doing exercises, and there are home exercises that can be given. A medication review. I wonder how many people that are on 4 or more medications really understand their medications and know some of the side effects. Some people have orthostatic hypotension, meaning when you get up suddenly from a chair, you might be dizzy. When you get up during the night, you might have a dizzy spell. Sit back down, and I'll give some help in terms of what to look for. Vision and hearing impairment does cause falls. If your glasses, for people that are adjusting to bifocals or progressive lenses, there's often falls. People that don't have the correct prescription, and people that are hard of hearing may not hear someone passing by, may not hear something that's occurring that they could therefore prevent a fall. And home safety. And that's a big part also of what the Visiting Nurse Association does. We go into homes and help people check for home safety. We do a personal assessment where we go through medications. We do an environmental assessment. To show you how significant falls are, 55% of falls statistically occur in the home. 23% of falls occur around the home, near the home. That's 78%. That's the majority of falls. If we can make ourselves safer within our home environment, we've really accomplished a great deal. The other 22% of the falls occur away from the home, and often with curbs in parking lots. We miss that curb. Risk factors that contribute to falls: people on 4 or more meds, people that have vision or hearing changes, dizziness upon standing, increase in age, and one thing we don't talk about, but urinary incontinence. Sometimes during the night, boom, you have to get up. You rush to the bathroom. You don't want to have an accident on the way, and I have a simple solution for that. Wear a pad. Don't be in a rush. Yes, you do feel full. Yes, you do need to go to the bathroom, but you don't need to rush. Wear a pad so you're not worried about the carpet. You're not worried about the floor. Other risk factors are people that have arthritis. I've begun having some arthritis for a while. My feet hurt, sometimes my hands hurt, but it's more the feet that we worry about in walking and being safe. People that have had a stroke, be it minor or significant, often they're then using a cane or a walker. Are they doing it safely? Depression can cause falls. People just aren't paying attention. How do I feel? They're not getting out of bed. They're not getting out of the chair. Therefore, they're not as active and their strength isn't as good. Cognitive, if people aren't alert and oriented, they can have a fall much easier. Certainly alcohol use. I think often it can be a combination of alcohol with medications, or it could be too much alcohol. And the incorrect use of assistive devices. We have a physical therapist who often at the end of the day will come in after he's been in the homes and he'll say, you know, sometimes I feel I don't accomplish as much as I want to, but I am teaching people more and more as I go into the home how to use that cane correctly, how to go up those steps and down those steps correctly and using a cane. And that's very important. Often just to accomplish that has increased an individual's safety considerably. As I mentioned, the Visiting Nurse Association does go into homes. We have registered nurses who are trained to do home assessments. Those are free of charge. If anyone's interested in having an environmental and a personal environmental assessment, I encourage that. We go in, we check the bathrooms. Are the grab bars there next to the toilet if needed? Are they near the tub? If you're taking a shower and getting in and out, I've even noticed, I've watched my husband bend over, dry his toes. He's not holding on to a grab bar. We're fairly young. We're not elderly at this point, but safety starts when you're very, very young. Young people have fractures. Inadequate lighting is certainly an issue. We're finding more and more. I don't know how many people have watched some of these hoarding shows that are on the media now, but we're going into homes, and indeed furniture placement is an issue, and there are those people that collect, and sometimes that collecting habit increases over the years. We have to go into homes and we clear a pathway from the door to the bathroom, to the kitchen, so that they are at least safe, and that if 911 is dialed, they can come in. We've gone into homes that if 911 was called, the stretcher could not come into the home. And that's the first thing that our registered nurse would do when she comes into a home, negotiate with the individual to at least create safe pathways. There's flooring issues, starting with those toss rugs that don't have a rubber backing. They buckle up, and sure enough, your cane, your walker, your toe will catch in that. I have a grandmother of many years ago. I remember she fell and fractured a hip because her toe caught in a floor register as she was walking, and down she went. I put reflective tape around my house. I have some steps that one might miss one because they're tile and you can maybe miss a step. I have white reflective tape on those. Out on our deck, outside, I've put reflective tape so that one can see the steps. In the home, if there's a register, put reflective tape around it so that your eye will catch that, and that's right. You might be asleep, but you're going to catch that. You're going to train yourself. As I said, obstacles in walkways and also storage. How many times, and I have a dear mother, she's in her 90s. I don't think she wants to share how much in the 90s she is, but I know I'll watch her reach for something in the pantry. She has a very high shelf. I'll get up and say, I'd like to get that for you. I don't think things should be too high or should things be too low. You're going to lose your balance bending down. She's had a hip replacement. If she would fall, it would be difficult for her to get up. So too high, too low is a message. Again, a home assessment can help with that. We've talked about throw rugs, spills. We should clean up right away, although Maggie and I heard a story this morning about someone doing a cleanup right away. You have to be safe doing that. It depends on where the fall is. Certainly if it's on a wooden floor. If you've had one hip, two hips done, two knees done, you might not be the person that should bend down and clean that up. You might fall. You might be better to barricade that area. Put a chair over it. Pull a chair on gliders. That's another thing. On wood floors, I have gliders. So you just kind of drag that over, put it over the spill. If someone comes in, say, would you mind? I'm sorry to ask you, but would you mind cleaning that up or mopping it up? Furniture, again, lots of clearance. Pets. I'm a dog lover. I have a huge dog, a 70-pound dog that I rescued, but he loves to be laying by the side of my bed. When I get up during the night, there he is, and he snores. He's sound asleep for I to say, Jake. I really am trying to train him to sleep away from the bed and not on the bed, my husband says. But we have to watch our pets. Put those cat Betty Buys and the dog Betty Buys away from your walking area because you can trip over an animal. It's bad for you and it's bad for the animal. There I go, animal rights. Cords, electric cords, that is such an issue, and especially with laptops nowadays. People are using their laptop. If they plug it in, they don't want to use their battery. They want to keep their battery for the next place they go. I've noticed those cords are just everywhere, and it's very easy to trip over those. Be very guarded. And then in terms of the transition from carpet to vinyl or vinyl to carpet, one can trip. If you have a walker, walkers need to adjust. You can have tennis balls on them and you go from one surface to another surface. The tennis ball will kind of drag on the carpet, but it's great for the hardwood floor. So darn it, when you have it's mainly two kinds of surfaces in your home, carpet and hardwood floors, you have to think, what is the safest thing to do? Does my walker need to be on wheels? That's great with carpet. However, it's really a risk in the kitchen. And probably more kitchens than not have either wood or vinyl or tile nowadays rather than carpet. Fall prevention, we are saying, and I've put as number one, implement some type of an in-home exercise program. If it's sitting in your chair, tightening your gluteus, meaning your bottom. If it's just lifting your legs and trying to get strength, they now have chair sizers, which you can sit in a chair and do the motions of riding a bike, but you're strengthening or you're encouraging your loved one to do that. So when they get up and walk with their cane or their walker, they have greater strength. we're asking people, and again, the home assessment would accomplish that, where to make your modifications. If a transition between the hard floor and the carpet isn't safe, maybe you need a threshold, maybe you need a safer threshold. Maybe the threshold that's there is buckling, and you can maybe trip on that. So you're not only transitioning from one surface to another, but you're going to trip on your threshold. We also encourage have an annual checkup for your glasses. Make sure you're wearing the right prescription. Have your hearing checked. Know that if you need a hearing aid, I can say my mother, I hate to use her as an example, was very resistant getting hearing aids. And I could stand in back of her and say something and no hearing aids, and she wasn't hearing what I was saying. And it is quite an adjustment to life. Although I have very young people that I'm working with they're out in the field and they're wearing hearing aids. So somehow, when you get 70 or 80 or 90, you get rather defensive that, gosh, I need a hearing aid. That means I'm declining. Not so. I look around and look at all generations, and I see very young people wearing hearing aids, and pride shouldn't be at stake for that. It's safety. It's also communication and keeping in tune with your environment. Foot care is very important, and footwear, and we'll get into that. With this personal assessment, your feet even will be looked at. The VNA provides foot care clinics. We have a health suite down at the senior center where they're Monday through Friday. On Thursdays, it's every other Thursday, we have a foot care clinic, and a lot can be detected in looking at one's feet. Are people able to clip their toenails? If not, is there arthritis? Is there some impairment that we should talk about? What's the circulation? What's the color of the feet? We can tell many, many things by having people come to the foot care clinics. For this, I want to stress, for this risk home evaluation, I encourage you all, call the Visiting Nurse Association. Our number is 337-9686. You ask for community services, and we have a registered nurse who's in charge of that program, and she'll make arrangements. You know, I talked to some people that were out of town last week at a public meeting, and I am very partial to visiting nurse associations, and I think a starting point out of Johnson County in Iowa is to call a home health provider. If they have a visiting nurse association, they seek grants for wellness. They have strong wellness programs, as our visiting nurse association does. So I'd start with a home health provider, preferably a VNA.
What would be an example of that?
I just go to your yellow pages. Okay. What town are you referring to?
Osceola.
Osceola.
50 miles south of Des Moines on Interstate 35.
South of Des Moines. Well, I know Des Moines itself has a VNA, a Visiting Nurse Association. They could maybe network you to another provider. We have a grant that we do our home assessments through. Not all home care providers do, but a Visiting Nurse Association, there's one in Waterloo, there's one in Des Moines, there's one down in the Bloomington area. They can network you to a provider that can help you with that. Or you could call our staff, our intake nurse might be able to research the area for you also. Certainly there's usually public health providers. I go to regional meetings with the county public health administrators, and often they have grants where they might go into homes for wellness checks. So that could be a start. In terms of footwear, we really advocate for shoes that fasten, be it, I'm looking at feet right now, I'm seeing good walking shoes that tie, or they can have a Velcro. But these floppy shoes are not good. You can walk right out of it, and your heel can hit the edge of that, and that can throw you for a fall. I used to wear Dr. Scholl sandals, the wooden type, because it toned your legs. I had many sharp pain go right up to my head from my heel when that slipped out, and my foot would come down on the edge of that hard platform, very painful. As I said, floppy shoes are very bad, and resistant shoes, both boots that have good traction, walking shoes that have good traction, slippers that have good traction. It is so scary to see people in their socks walking on hard wood floors, unless they're the socks with traction. Now, I think with arthritis, more and more people are wearing socks because the doctors are saying stay out of drafts, wear socks to protect your joints. Find the socks in most. I was in one of our local pharmacy stores the other day. They have nice velour socks with traction, treads on them. That's what you want. When you go to the hospital or your loved one goes to the hospital, they're going to give socks to your loved one, but they're going to have traction on it. Bring those socks home. People say, "Pooey, I don't need those." That's excellent. You do not want to get up on linoleum. Yeah, linoleum is the worst, but hardwood floors are bad also, just to be in stocking feet and walk. And you know that phone can be, it's so interesting. I have fallen once, thank heavens. Well, I have fallen twice, and yes, I broke a bone on the second fall. The first fall I had was the phone was ringing, and I just had to run and get it. And I thought later, now, why in the world was that phone call so important that I ran to the phone, slipped, I saw my feet up on the ceiling, and I was lucky. My head really hit the floor, but as far as I know, I didn't get injured. I had another fall where I was carrying something. The house was new to us, and I went down steps. The same happened to my husband, and both of us missed a step. It was into a sunroom, and we just weren't used to that third step. And I fell, and I knew something had happened, and I broke my ankle, and that was not good. So boots and shoes with traction and that fit well will do a lot for safety. At night, I guess the message I want to give, I think it's good to have night lights around. I certainly do. Some people say I can't sleep with them. Again, if my mother or some guests come and overnight with us, I find those night lights pulled out. They just can't sleep with them. Well, I have them in the hall, and I have them on the way to the bathroom to show the journey where it is. If you can't sleep with it in your bedroom, I think that's too bad. I think you should discipline yourself and learn, because you need to get up when that bladder tells you to, sit on the side of the bed, see if you're dizzy. You're not quite awake yet, but sit there for a little bit. Put those slippers on that have rubber traction and slowly walk, and know where the foot of the bed is. If you have a foot, some people now have the beds with no head or foot rail to it. We do, and I like them, and I'll always have that. We're asking people to stand up very carefully, especially if you're on several kinds of meds. Nowadays, it's blood pressure meds. You could be on cholesterol meds, but the studies have shown if someone's on 4 or more medicines, probably lightheadedness will occur at some point of the day or activity. And often during the night, you've been sleeping heavily, you now have to get up, your bladder's full, you don't want to have an accident, and you're going along. But a third thing, and I didn't write it down here, but I do think wear a pad at night. With this bad weather, and I talked to a few people as I walked in, and we're so tired of it, but it is a good challenge. I'm sure the emergency rooms are busy. I'm sure there's falls. But even if this was our only icy day outside, say it's been a lovely, lovely winter, then we're less guarded than we are right now. We need to be alert and be wearing the right shoes. And I was visiting with some people before this meeting and saying, as I got out of the car today, most falls occur in the parking lot getting in your car. The leg slips out from you and you go down. You can't grab your door, you can't grab anything, you go down. And also getting in. When you're walking across a parking lot, whether it looks like it's been cleared or not, your eyes need to be down, studying that parking lot. You don't need to be sociable with that person who's walking with you or someone that's crossing over. Once they're near you, if you see someone you know, then stop when they've approached you and say, hi, how are you? But your safety should be primary on your mind. And walking across those parking lots, number one, if you can park near the entrance, that's ideal. Secondly, study that parking lot. Wear boots, good traction. Have your hands as free as possible. For those that use canes, fine, but we're carrying bags, we're shuffling them on our shoulder. I do that, and that makes you lose your balance. You don't want to lose your balance. And again, it's young people and people over 50 that have to follow through on these safety steps. Getting in and out of the car, going up and down curbs. How many falls? I know we had a dear family friend who we saw recently, and she was just bruised. And people who wear glasses, and they are getting lighter and less, causing less injury as a result. But still, when you fall, your glasses press against your nose, and her nose was broken. She had bruises all over, and she had missed the curb. So again, eyes down, studying. For people with bifocals or progressive lenses, make sure that your prescription is correct. If your glasses need adjusting, do it before you get in and out of the car. Sometimes we see double, and I get used to seeing double. I have progressive lenses, and I can look down and sometimes see two curbs. That means my glasses need adjusting. Icy patches. I have a brother that's blind. He can't see the icy patches. I just hold my breath when I know that he's downtown walking around with his white cane, and I talk to him about icy patches and pooey. The sidewalks have been cleared. He called the police department. All the streets are cleared and all the sidewalks. He's just fine. And I said, well, when I'm visiting you sometime, and I don't want to be visiting him in the hospital nor in the ER. Exercise is very, very important, even if it's minimal. I know so many of my friends are either thinking of retiring or have, and it seems the first thing everyone does is join curves and gets involved with Monday through Friday exercise. That's not necessary. The benefits of exercise, basically balance and strength. It helps you get up and walk safely. You know when your legs feel weak. You know if you've had a cold or the flu and you've been resting, your stability is less than it should be because you're weak, and exercise will prevent that. It's never too early, in summary, or too late to begin fall prevention activities. Increase activity, getting up, moving is a key to preventing falls, and a reduction of any fall risk is beneficial and decreases falls. We ask that you call the Visiting Nurse Association. We do have a grant that we seek every year, and we're fortunate still to have room on that grant for more home assessments, and we highly encourage people to do that. And let's have a conversation. You are caregivers. Fall prevention certainly needs to be on your mind to create a safe environment for your loved one as they decline. I had a twin who was very ill and terminal and passed away, and I know with each week there was a change. We had to do different things. He liked to go stocking-footed on a wooden floor. I went to different places, found these hospital. You can go to Crowded Closet. You can go to a lot of places and find these socks with the treads on them. And he loved them, and he was safe with them. Walkers, we had a physical therapist come in and assess. And did his need wheels or did his need tennis balls? Wheels he chose. I can't say I was thrilled with that. He also had one that he could get his walker out in the garage, and he was cleaning out his garage, so he'd put the brakes on and sit there. And of course, then I was thinking, did he really put the brakes on? When he stands up, is he going to fall over? You become a worrywart as a caregiver. You just anticipate everything that can go wrong. Sometimes it does, sometimes it doesn't. But it's a heavy burden to be a caregiver, and it's tiring. So I'd like to hear from you, and why don't you share with us some of your experiences? Sometimes it's finding the resources. And I passed around a book or a brochure that says how fall prevention came about. And again, Johnson County Livable Community was huge in starting the initiative. But there's websites people can go to. Caregivers can make calls to hospice, to the VNA, to learn who does this or that. We will network you all to resources you might need. Yes?
I was just curious if you have any suggestions for helping people be more realistic in their assessment of their skills as they age. My mother has always made, and is a wonderful cook, and makes Christmas candies. Well, this year she was making huge amounts of candies and didn't realize there'd been an ice storm, stepped out on the deck. Fortunately, she got the candies put down before she fell and poured boiling syrup all over herself. But she just went down and my dad, clipping his toenails after a shower, slipped and fell off the commode, hit the bathtub, broke 3 ribs. He's 90 years old, and they couldn't give him enough pain medication really to control it because he's slow enough. They don't need to slow him down anymore. But I don't know how to get him to just.
We as children with our elder parents do have a set of worries that sometimes our elder parents don't have. They think they're just fine. As long as they're in their own home, they know every crack and every corner. They know everything about their porch they need to know. So they're going to be just fine putting that fudge out there. And they usually know how the ice falls. But there will be a fall. My mother just reached for something in a closet and fell forward and then down against coats and whatnot, but couldn't get up and didn't have a lifeline at the time. I think you start, if your parents are in the 90s, there needs to be a conversation.
Yeah.
There needs to be a conversation. And if you have a good, healthy, kind relationship with them, sometimes you put it that you need them to have a lifeline. It'll make you feel better. You're staying up at night worrying about them. So put the burden on your own shoulders and say, I would feel better. Let me buy the lifeline for you. Then you can press that, and dad or mom don't need to run out.
I have a carrier for my cell phone, and I hate to say I don't have it on now. I've got my cell phone in my purse, but I do have where I can wear my cell phone.
That's wonderful. And that needs to be, again, that's training. I got a cell phone for my mother, and I got a cordless phone. But sure enough, when I call and she doesn't answer on the second ring and takes 4 to 5, I know she didn't set it in her lap as she's watching Downton Abbey. And so, you feel guilty for calling.
And I put it on even at home, and wear it.
That's wonderful. That's very safe. Carry your cordless phones with you and have the person you're caring for do that also. Again, my brother who's blind, he's on a family cell phone plan that my husband and I just said, we're doing it. We're worried. No arguments, please. Carry that phone. He's a little OCD. Well, I'm afraid it'll get stolen. No, carry it with you. So if you fall, you do 911 or you call me. I finally have him wearing a lifeline, but he doesn't like wearing it because when he showers, it gets wet. There's always a reason. I don't know how to answer all these questions other than we as children have the responsibility to educate very patiently, and we as caregivers, and we just never stop, find another message, another way.
My mom
Yes.
had a lifeline, but she'd take it off and put it on the nightstand at night. Well, if she falls on the way to the bathroom,
That's right.
she's not going to have it with her. So,
That's right.
but
And my mother was so worried, well, I'll strangle myself during the night. You know, it'll choke me. So you negotiate that. They don't want the wrist because people see that. Yes.
I just had a question about the home assessment. Is there a minimum age that someone needs to be before you'd go out and do the home assessment?
No. If there's a safety concern, a safety issue, we work with people with disabilities. So because this is a grant and it's limited, it's finite, we certainly hope that there's a need there, that it's someone who has some challenge, that there's a concern for home safety. But certainly someone with a disability would be eligible for that. Well, these are good questions. I haven't answered well how you negotiate with your parents or but that's the word. It's called negotiation. You just have, with a smile, with a gentle conversation. Mother now has her hearing aids. I think she wears her lifeline. We got a gold chain, so when she plays bridge, no one knows that she's wearing it.
Strong, though. She has made it tonight.
They're 86 and 89, so they're not quite 90, but
Well, I'm that age.
yeah.
I was going to say too, my father enjoys his poor hearing because he doesn't have to listen to my mother bellyache about that. So I'm not getting hearing aids. I don't want to listen to anybody.
Well, we have a friend who has a very good job, and we've known him since he's been in his 40s. And now he's a little bit older than that. We've known him for 20 years. He still won't wear a hearing aid. We know he's studying our lips. We know he's missing a lot of the conversation, but his wife says he likes it that way. So I don't know when we're going to see that person have a hearing aid, but he likes it. So there is individual choice. We are our own decision makers. You can only do so much, but we as healthcare providers will try and provide as much information to you as we can. I think for your situation of home assessments, I would start in Des Moines with the VNA and ask their opinion. If there is a local public health provider, you could call them up and ask who would they recommend for coming in. Because I know Lynn County Public Health, I think they go in and do wellness checks, home safety. So there are providers out there. You're not alone. So I thank you for your time. It's an honor. Thank you.
You're watching City Channel 4. On TV, online, on demand, on Facebook, and now on the go on your mobile device.